Welcome to my YouTube channel. Before I begin my presentation to you, dear viewer, I would wish first say, may the Ugandan matters intercede for us. I am Thomas Mujisha in the land of the matters. I'm in Uganda, and behold the medal to the Ugandan matters. Friends, today I come to speak something small about the bioethics. You will even want to call it the medical ethics, but there is a slight difference. When I talk of ethics, what am I talking about? I'm looking at that philosophy that leads us into the systematic way of defending or recommending certain actions as right or wrong. Or even that logical versus illogical manner of making decisions towards certain actions as being good or bad actions. Now, when you talk of ethics, it comes all the way from the word ethos, ethikos, that might be much of the Greek, but it's talking of that habitual way of systematizing and making right decisions against the wrong decisions. And now, what is bioethics, if I can take that definition? Bios means life. So we're looking at that ethics towards life. And when we talk of bioethics, it's a bit different from medical ethics in a way that bioethics goes much more broader. Under bioethics, we shall see things like the Hippocratic Oath. We shall look at things like the care for the dying. We shall look at things like truth telling to the patients. For instance, I'm a health worker. Must I tell all the truth to the patient, or there should be some truth that I should conceal to myself? And then we shall also say, for medical ethics, it is more dealing with a health practitioner, a doctor to the patient relationship. And that is a bit more limited. What are those codes of conduct as a professional that I must match by those codes to be a good practitioner in the health sector? That would be medical ethics. I know, friends, you might have heard of the 4 basic principles of medical ethics. And these I will just rush through because this is not my topic for today. My topic for today, I'm more talking about the principle of double effect. And this principle of double effect, I felt I should first bring us through the bit of an introduction about the ethics, what are those bioethics, what are those medical ethics, what are those principles, and then we go to that principle of double effect given us by St. Thomas Aquinas, my patron saint, and the priest and doctor of the church, by the way. So these principles, the 4 basic principles of medical ethics, one is the autonomy, autonomous. Being autonomous means being self-independent, self-sufficient, that I can make a decision for myself. We are putting the patient at the center. That the patient can say, I make my choice, it is my life. Above all things, is independent. And 2 is the justice. That how right and how ethical are we in our distribution of our limited resources in the health sector, for instance, okay? So the equal distribution of those resources aimed at the health sector is what we are calling that principle of justice. That all patients must be equal in our eyes as health practitioners. Next is the principle of beneficence. When I was doing Latin way back in 2009, 8, when I was still in the minor seminary, there was ben, it meant good. So beneficence, it is inviting us to do that which is good to the patient as health practitioners. And then the principle of non-maleficence, mal, I think in French, I don't know whether Latin will be the same, but mal means bad. So non-maleficence is an invitation that first and foremost, we do no harm to the patient. We do that which is not bad to the patient as health practitioners. And for me, I would want to remind myself of that principle, the slogan given us by our grandfather in medicine, Hippocrates, when he said the primum non nocere, and this is the guiding tool that first and foremost, may I do no harm to any client, to any patient. Now, friends, I come to the principle of double effect. What is this principle? Some people call it the doctrine of double effect. And this was given us by Thomas Aquinas. By virtue of being double, we are talking of 2 effects. One effect is bad, one is good. That which is bad is even harmful, okay? And so, before we come to that, we want to say that this principle of double effect will accept an action to be morally permissible if and only if the resultant has been out of that effect which is bad, but that there was no other alternative of achieving the end without involving, there were no other alternatives, okay? So it tolerates an action as morally permissible when the effect which has come out has not been intended. The harmful effect has not been intended. The bad effect was not intended, but is the one which has, been involved for us to get the effect. So the last effect has come but the harmful effect was not intended, okay? So it comes as a side effect. The harmful effect has come as a side effect of our action, but it wasn't an intended thing. So, of course, as human beings, we have many evils that we commit and all that. But I want to talk about the two evils. Now, I want to talk about the physical evil and the moral evil if we are to understand this principle of double effect. Number one, what is this physical evil? Physical evil is that does not fully involve the free action of the will, okay? So, we want to read at that rational judgment of our actions as human beings. We need to know that the physical evil is that does not fully involve the free action of the will. While the moral evil, which is number two, the second evil, it is that fully involves the free action of the will. So we are talking about two things, very important. The intentionality. Was my intention to have a harmful effect? No. But the harmful effect has come because of the side effect of my action, okay? So the physical evil, as we shall see, is always, employed in our judgment of the principle of double effect. And it does not directly employ the free will, as I said. Why is it permitted, this physical evil? It is permitted just because no other alternatives were possible in our achievement of the good effect which we wanted. Now, St. Thomas Aquinas, as I said, is the founding father of this principle of double effect. And for me, this is a realistic man. He's a priest and doctor of the church, and he's realistic because he knows our human weakness. He knows us as human beings being imperfect, that we cannot reach the perfection which is God. So, he gives us 4 conditions that if an action which use a harmful effect as a side effect of the action, but we morally permitted the action as good, then these conditions must be valid. Allow me to take you through those conditions. Condition number 1 is the act itself. That this act should have been morally or ethically good or neutral from the beginning. My action, was it morally or ethically a good one? If that was the point, then I go ahead. Number 2, condition number 2, the moral agent, which is the person, you and me, must have intended a good effect. That's the most important, good effect. Meaning that the evil effect has come only as a side effect of my action. So what was the intentionality of me, the agent of the action? What did I intend? A good effect? That's very important. Number 3 of the condition is that the good effect must be greater or equal to the evil effect. This is when there is an aspect of strength in our judgment of our actions, okay? In our judgment of our actions, okay? So, dear friends, I was still talking about the 4 conditions. Now, in the condition number 3, if I can just repeat for the sake of clarity, is that the good effect, which is our intentionality, which is our intended effect, must be greater or equal to that evil effect that we are talking about. And we said the only evil effect permitted or is considered is that which is physical effect, that our free action of the will is not fully involved. And then let me take you to number 4 of the conditions. Thomas gives us 4th condition saying that the good effect must not have been attained by means of the bad or evil effects. So our means of attaining that good effect must have been means which are not involving the bad or evil effects. So dear friends, let me give you a case scenario, by the way. And this is a direct and a practical example that I'm giving. Look at a physician, a doctor. Let me use the local word. I say a doctor. A doctor has a patient, and this patient is having cancer of the colon. We say colon carcinoma, carcinoma of the colon. And then this patient comes complaining of severe pain. That too much pain. Some people use the word excruciating pain. Okay, then this doctor thinks and judges it necessary to give morphine as a treatment. Morphine, as if I can make it, we have 3 ladders of analgesic or pain relieving. And ladder number 1, we have the simple NSAIDs, the non-steroidal anti-inflammatory drugs called the ibuprofen, piroxicam, those simple ones. And then stage number 2, we have these we call the codeine, ladder number 2, step number 2 in the analgesic ladder. We have the caffeine, cocaine, and then tramadol and all that. Then step number 3, that's the highest, and there we have the pethidine, we have the morphine. Now I'm talking about morphine, okay? So he judges it, he says, let me give morphine. But morphine, in a good intention, is to relieve the pain. And this was the intentionality of the doctor, to relieve pain. But then, it is also known, scientific, that morphine has also a capacity to decline to depress our respiratory system, okay? And so, but then the doctor goes ahead and gives morphine. Now, morphine, it will relieve the pain, but the side effect of it, a known effect, is that it might depress the respiratory system, and so it might accelerate death. Now, 2 days later on, it is reported, it was sad news, that this patient had breathed, breathing to the last, okay? So had his last breath. And then, now, judge with me, based on using our principle of double effect, or the doctrine of double effect, was this physician or doctor ethical by his action, or he was unethical? Judge with me. Number one is, what was his intentionality? He intended a good effect, okay? He intended to have pain relief from this patient who had too much pain. Cancer patients usually suffer a lot of pain. In the future, I will speak about the palliative care, especially to those with terminal illnesses. I'm looking at cancer, I'm looking at HIV in its stage 4. I'm looking at those tough conditions. And then for him, his intention was to help this patient. This was the intention of the doctor. And so the death which came in, it was unintended and came as a ramification of that last, unwished effect that came, and therefore we shall say this doctor was ethical by his decision. So dear viewers and dear listeners, you would wish to always judge your actions and use this doctrine. Follow the 4 conditions given us by St. Thomas Aquinas, the priest and doctor of the church, saying, ask what is the nature of my action? What is the intentionality of me doing the action? And what is the nature of my good effect? And what's the strength of this effect? And at the end of the day, use the 4 preconditions, and I know you will enjoy your medical practice, you will enjoy your pastoral care, and you will keep happy in your ministry. Loving you so much. All the best from Thomas Mugisha. I am a medical clinic officer and highly interested in the clinical philosophy. Medical ethics is my greatest desire. Be blessed to you. Bye.